A number of the hospitals in my district are already at full capacity.
Hospitalizations and daily deaths from COVID-19 keep breaking new records. How the governor is responding as he continues to fend off criticism that his orders both go too far and not far enough.
If everyone will adopt this practice of wearing a face mask when you go out, there will not be a need to shut down.
And the pandemic, setting the stage for steep budget cuts. We're talking with those already staking a claim to what money will be available. Hello, thank you for joining us for State of Texas. I'm Josh Hinkle, and I'm joining you once again from my home studio as our team continues to social distance amid the coronavirus surge in Texas. This week, the eyes of Texas are on the Rio Grande Valley. It's one of the state's largest COVID-19 hotspots right now, and epidemiologists warn hotspots are getting harder to contain. In the spring, many outbreaks were linked to indoor locations like meatpacking plants and nursing homes. And as our Maggie Glenn explains, community spread is now making containment more challenging.
We were running short of staffing and other types of supplies and equipment.
So, doctors in the Rio Grande Valley chose to fly a COVID-19 patient to Northwest Texas healthcare system in Amarillo last week.
A critically ill patient with COVID who was on a ventilator due to the fact that they did not have critical care beds available at that time for this patient.
The 700-mile transport exemplifies the level of need in the state's southern region, a new hotspot.
We have let our hospitals know in that area that we are open to take some of the patients that they cannot accommodate if need be.
Amarillo faced a similar concern in May due to outbreaks at meatpacking plants and nursing homes, but stabilized once the state surged resources to the area.
When the state knew it was a long-term care facility or a meatpacking plant, it's one spot. You can go in and globally test everybody. When you have multiple zip codes that are having 200, 300, 400, 500 cases in that area, much harder. We essentially had a campfire, and it's a lot easier to put out a campfire. We didn't put it out completely. And so the embers from that campfire have now spread into the forest, and we have a full blaze.
Maggie Glenn for State of Texas.
Governor Greg Abbott says he has been holding virtual meetings with mayors, emergency managers, hospital executives, and other local officials in South Texas.
Looking at hospitalization rates, they are improving in many regions across the state. In the Rio Grande Valley, of course, it is more serious than it is in any other region in the state, which is exactly why our key focus right now is surging medical resources into the Rio Grande Valley to make sure that the medical needs of the people in the region are fully addressed.
We also spoke with former State Representative John Zerwas. The doctor resigned from the legislature last year to become the Executive Vice Chancellor for Health Affairs at the University of Texas system. He also advises the governor on hospital capacity and the medical supply chain. Zerwas told our Wes Rappaport that the state has substantial hospital capacity and enough beds for patients.
We brought in well over 2,000 people and pushed a lot of that staffing down into the valley, which is where right now there's the greatest need. We've also got other public assets from HHS nationally and as well as Department of Defense, both Army and Navy teams that are in different places across the state. So we are reaching out, to all levels of manpower, doctors, nurses, respiratory therapists, to come in and give us a hand. Because despite how effective hospitals are at flexing their manpower up and down, depending on how many patients they have in the hospital, nobody has the ability to just prepare for something like this on a regular basis.
Could Texas handle a surge in cases and importantly, a surge in hospitalizations?
So we do have some hotels that are on contract with us that we're using to try to decompress the hospitals to create space for people that are more ill. We're looking at things like nursing homes and long-term acute care hospitals, these types of places, rehabilitation hospitals outside the hospital that can accept a patient, making room for somebody who really requires the skill set in an acute situation.
A new poll finds 65% of registered voters in Texas believe that the coronavirus pandemic is out of control. The poll from Quinnipiac University found 47% of voters support Governor Greg Abbott's response to the pandemic, while 48% disapprove. 80% of Texas voters support the governor's order requiring masks, and 53% of voters said they do not want the governor to issue another stay-at-home order. While school districts figure out what this fall will look like amid the pandemic, there's growing concern that winter could spell trouble for the state's education system. Wes Rappaport once again joins us after speaking with the retiring Speaker of the House, Dennis Bonnen, who oversaw massive education investments of more than $11 billion last year.
We cannot expect parents to continue to work from home or go to work and teach their children. We cannot continue to not teach our children. We cannot continue to not produce an educational product to our students. We cannot afford that. We must keep teachers safe. We must keep students safe. But candidly, we are creating more harm to the kids of Texas by not educating them. And you can educate them virtually. You don't have to put them in the classroom to do it. Now, we do know the best education is in the classroom. We know that. But the reality of it is we have got to come together and work towards educating the children of Texas now, because we can't let them be another statistic of the pandemic.
Texans largely think the reopening of the state's economy came too soon and was too fast. And we're learning that at least out of this poll, that more Texans are critical of the state's response and the leadership at the top. Do you agree with that?
No, I don't agree with it at all. I think that the only thing that I think was something that I would have wanted done different is we probably shouldn't have opened the bars back up. The reality of it is people are not largely spreading the virus, going to work, doing your responsible things. We have summer school going on in different parts of the state. They're not having a problem. Where the problems are existing is when you have extracurricular activities, where you have people, and I don't mean school related, I mean going to the bars, having a backyard party, doing the things that you've been told aren't a good idea, having people protest and gather and yell and shout chants, which they have every right to do. I would never suggest they shouldn't protest, but the reality is that didn't help. Memorial Day, people had enough and they went out and had the best Memorial Day they had in a long time. That didn't help.
Some have said that, you know, Bonnen's on the way out and he can say whatever he wants, but there's no, you know, legislative commitment to anything that he's saying. Why should people listen to your perspective on these issues?
Well, most of what I'm sounding off on is not about a legislative commitment. Quite frankly, there's no legislative commitment to wearing a face covering in public. I'm simply repeating what medical experts are telling us and what good science and good intelligence is, that if you wear a face covering in public, you can have more of an economy. You can have kids being taught again. You can go have some extracurricular activity if you just follow these health guidelines. See, I'm honestly just repeating what intelligent medical professionals are telling all of us, and hoping and praying that people will listen. But also working, I have a responsibility to finish out my term as Speaker. And that means working closely with Governor Abbott and Lieutenant Governor Patrick, and the three of us are working very well together. We're talking regularly. And so there's a responsibility to continue to fill the role. And there's a responsibility to tell the truth and to tell the public what they need to hear so that they can have a fuller life, a fuller economy, a fuller response and reaction to COVID-19.
Naming the nursing homes where patients are dying from COVID-19. When we could all see the data, the Texas Health and Human Services Commission does not believe you have the right to know. A test of privilege? How some law graduates say a decision to postpone the Texas bar exam highlights inequities. And looking forward to the legislative session this January, an in-depth look at lobbying that's out of the public view with the Capitol closed.